wonder, what is a day like when you are a ICU nurse? And what should I expect if I want to become an ICU nurse? Well, in this video, I'm going to go through step by step how ICU nursing is and to see if that's an interest to you. So keep watching. My name is Christine and welcome to a new video. If this is your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing, hitting the bell so you don't miss a thing. I still remember being an ICU nurse, and I still remember how much I loved it. I really loved the critical care thinking. I loved really knowing my patients from head to toe, in and out. And I also loved being there for them and for their families, because definitely when you're in the ICU, you have to have a feeling of empathy, a feeling of being holistic. And being an ICU nurse is going to take a lot out of you, because you also have to medically manage a patient as well as be there for their family. So now being a CRNA, it definitely allowed a foundation for me. When I was an ICU nurse, I worked at NYU Langone Medical Center in New York City. And I still remember my first year as a ICU nurse. I was a part of a residency program. So right when I graduated my bachelor's of nursing, I went right into the ICU, and it was definitely a big transition for me. Being a brand new nurse, not knowing, even though yes, I knew the information, I didn't have that critical care thinking skills. I was a novice, and I always thought to myself, I want to be an expert in critical care. I still remember being a novice, and to go more in detail into that, when I was in NYU Langone Medical Center, I got an opportunity to be a part of a residency program where they followed me throughout a year. From the first day to the last day of the year, they followed me and guided me. I got didactics, which was great. I got to learn a lot about drip management, a lot of different pathophysiology. Also had a support system from other ICU nurses as well as nurses in other areas in the hospital who were also graduate nurses, which was great. So I remember going to the unit, for example, to start my first day, and was with a preceptor. And basically in the ICU, you have either one really sick patient that requires just one nurse, or you might have two patients that are sick, but you can manage them with one nurse. Rare occasions, you may have three patients, but at NYU Langone, we mainly had two patients. When you step into the nursing unit and you get report, you learn about this patient from head to toe. You start off with their history, how their course have been since they've been in a hospital, what type of drips they've been on, what type of experiences they've had, any type of episodes of pathophysiology, maybe medication management, what kind of drips they were on, what kind of antibiotics, what type of procedures they've had. And you definitely follow that patient, discuss it during your report. Also, when you go to see your patient, you have a head-to-toe assessment to make sure there's no changes from the night before. And you really go through all your drips. Some of your patients can be on multiple drips. It may not be on just one drip. It could be up to like 5, 6 drips, depending on it. Some of the patients you'd have are ventilated, on a ventilator, hooked up to a mechanical ventilator. And they are on sedative medications like propofol and fentanyl infusions for pain and keep them asleep. As well as maybe they're having issues. So for example, maybe they're septic and they're on a levofed drip or a neo drip. Some patients may have cardiac anomalies where they've had cardiac surgery and they're on epi drip, dobutamine drips, dopamine drips. There's so many different drips that you'll see your patients on. The nice thing about ICU nursing, you're constantly titrating medications, depending on what's going on with their heart, depending on what's going on with their blood pressure, depending on their ABG or venous gases. Also depending on what the surgeon or the attending sees that would be best for that patient. You definitely see that. You also learn something about pathophysiology. You know the healthy, of course, when you've learned in school, but you learn about the sick heart, all these different disorders patients can have, and how that ties into your anesthetic plan. The nice thing is during the mornings, if you did work day shift, they'll have something called rounds, and you'll be a part of that. Because yes, the doctors will be talking about the patient, and also they're doing a lot of teaching, but you're also a part of it to go through, you're the nurse and you're there with that patient. What have you seen? How can we make this patient have a better course? And yes, you may not have all those answers, but you can learn and see why are we doing certain medications? Why are we doing certain procedures? And see why this ties in to help this patient for their future. As well as when you're an ICU nurse, you're with that patient and you're with their family. And you're really developing that relationship because, the family members can be very stressed, can be very nervous. They can be going through a lot of social and psychological issues. And you being the nurse and being there for them, you're making a difference. Okay? And a lot of times when you're an ICU nurse, you forget that. Sometimes you become something called numb to the situation. But try to keep that humanity because sometimes you forget that you're making a difference in someone's life. Sometimes there've been situations where you've had this patient been really sick, right? Gotten better, and slowly have gotten better. And then maybe they're ready to move on from the ICU to a regular unit. And you learn, you see this person, you develop this relationship with them, and you get to see how their health have improved. And it makes you feel great knowing that you were a part of that. As well as sometimes you may see this patient maybe 5-10 months later come back to the unit, walking, talking, having a conversation with you, and you're like, wow, I remember when you were like sick, the brink of death. But now look at you. You're making it. You're doing good. So definitely as an ICU nurse, you see it all. It's not just critical care thinking. There's a whole spectrum of things when you're an ICU nurse. It's holistic. Mind, body, spirit. It's everything that goes into it. You're also learning from different people who come see the patients, different areas. Like it's an interdisciplinary approach. So definitely ICU nursing, you're going to learn a lot about critical care. You're going to learn your pathophysiology. You're going to have one patient who are really critically ill, and you're really knowing that patient in and out, titrating drips, and definitely changing vent settings and being part of intubation, extubations, taking them to procedures. And it's just a wide range. This is very few things I'm talking about, but this is just a highlight of what ICU nursing is about. And if you're really interested in becoming an ICU nurse, you know what? Try it. Try it for a year, see how you feel, see how you like it. And then if you want to continue, you can continue doing it. But this is a great area. You can expand yourself as well. You can be a charge. You can do quality improvement measures. You can do research. You can do so much more. And yes, I am a CRNA, but I definitely loved my ICU experience. I felt it gave me a really good foundation for where I'm at today. And yes, being a CRNA is different than ICU nursing, but it built a foundation. And I feel a lot of those critical care management skills definitely are with me to this day. And if you want to learn more about CRNAs and the career of becoming a CRNA, definitely click one of these videos over here, and I'll see you in that next video.